Now I would like to invite Ms. Darcy Weaver to present and tell us about the AMAZE project already mentioned by Janelle. And you will look into three different questions. How has your project emerged and developed over the years? What has changed? What kind of projects do you offer to children and adolescents, their parents and educators? How do they look like? How do they like and use them? Sorry. How has the integration of AMAZE videos influenced the educators' approaches to teach sexuality education? How do you decide on the topics, the features, and how do AMAZE videos facilitate the engagement and active participation of students during lessons? And you will have now time for your presentation. So go ahead, Darcy.
Great, thank you so much. And thanks for posing those really important and interesting questions. And thanks, Janelle, for the introduction. And also, we were thrilled to be one of the groups highlighted on at the Switched On conference. So great to hear more about that. So I always like to start talking about AMAZE and begin with our origins. And so our founders were in Vietnam, and they went to an art exhibition that was curated by young people for young people. And in this exhibition, young people were using animation to discuss SRHR topics, and they loved the idea. They thought it was so fantastic. So they went back and started AMAZE. And we sort of started becoming more and more popular, and then groups all around the world started to reach out, and that's basically how we've grown. It's been quite organic and very exciting. So AMAZE is an initiative by Advocates for Youth, which is an NGO, a nonprofit organization based in Washington, D.C. And we implement AMAZE with partner organizations around the world. We have a wide range of free videos and resources around SRHR topics. And because we produce new content every 2 weeks, we have, our catalog is widely growing. And within each kind of major theme that we have within SRHR, we've got several videos that people can choose from. So I have a video I'd like to share. It's just an intro video to AMAZE, so I'll go ahead and play that now.
Can you get an STI but not have symptoms? Oh, I bet AMAZE has a video for this. Yep, here it is. Wow, AMAZE has everything. I wonder, who's behind all this great info? AMAZE.org. More info, less weird. It's no surprise young people have questions about STIs, relationships, and their bodies. When sex education means awkward lessons and embarrassing questions without honest, age-appropriate answers from trusted sources, young people are left in the dark, turning to misinformation online, pornography, and myths that other kids share. That's where AMAZE comes in. An engaging, trusted resource making sexuality education universally available to the YouTube generation. Our flagship YouTube channel alone has over 50 million views. With multiple video series and distribution platforms, AMAZE has evolved into a large international community of teens, educators, and parents. AMAZE leverages the expertise of sexuality educators, the creativity of animation professionals, input from our youth advisors, and the power of the internet to create and share free educational resources. That's true. I've learned so much, from relationships to gender identity and sexual orientation to what to expect at the doctor's office. AMAZE has over 200 videos, but our programming is more than just videos. AMAZE provides lesson plans for schools, content and tools for parents and allies, integration into healthcare systems, and even a coloring book and comic. Parents love AMAZE too, with many resources to help get through awkward conversations and become askable parents. That explains why my parents stopped saying, "Jane, there are birds and there are bees." Now they give me real information that I actually care about. AMAZE is an open platform where we welcome and support global partners as they adapt, integrate, and disseminate AMAZE resources to their audiences. Together, we can change the world and help young people build happy and healthy futures. Now, let's find out more.
Great.
Can you get an STI but not...
Sorry, let me just go ahead and advance. There we go. Great. I hope that that provides a good introduction to AMAZE. In terms of how we develop the content, so that was one of the questions that was posed, we have sort of a three-pronged approach. So we have support from technical experts around the world, including medical professionals, and that sort of then allows us to, on YouTube, to be identified as a credible source of health information. So one of the things that we were just previously talking about. We also are informed by the UN's International Technical Guidance on Sexuality Education, as well as national and regional guidance. And then the third pillar is that we are guided by a group of youth ambassadors. These are young people ages 10 to 16 from all over the world who help us identify emerging topics. They set the tone, and I think one of the things that they do is also make sure that the videos stay really relevant and funny. And if you have watched AMAZE videos, I think that you'll find them to be quite entertaining in that way. So even if you are familiar with AMAZE, we have what is sort of, for lack of a better term, called our standard AMAZE videos. We have over 200 of those, but we have two other types of videos that I'd like to talk briefly about. One of those is called Ask AMAZE, and those Ask AMAZE videos are shorter than a regular AMAZE video, and they actually answer specific questions that young people have posed. So those could be anything from, how do I use a tampon, or why does it burn when I pee? Those are two of the topics that we cover in those Ask AMAZE videos. And then we have a third pillar, which is our AMAZE Junior videos. And those are videos, they're kind of broken up into two components. So one set are actually for parents and carers who want to be able to answer those developmental questions that young people might be posing to them, like where do babies come from? And then the other set of AMAZE Junior parents, or AMAZE Junior videos rather, are for children ages 4 to 9, and those are meant to be watched with families, with parents and guardians. So just wanted to highlight those. And then in terms of the free resources that we have available, so on our website, underneath each video, there are 3 sections. There's a section for parents and carers. As I mentioned, we have those free videos, but we also have discussion guides, books, additional resources. There's a second section for young people, again, with links to additional resources and videos. And then there's a third section, and that's specifically for educators and NGOs. And in that, we have free scripted lesson plans, learning materials, games, discussion questions, and lots of other free content. So one of the questions that we were sort of thinking about was how AMAZE helps facilitate engagement. And we feel like our videos and that videos around SRHR topics are able to engage young people through a variety of things. So obviously we've got the high quality animation and the graphics that help continue to keep students' interests as they're watching it. It's also really helpful when we're talking about different learning styles and making the kind of content more accessible and engaging. Videos also allow us to do some storytelling, and so we can use various techniques to kind of keep a narrative going, again, raising interest and keeping interest. We can provide demonstrations, so videos can talk about different parts of maybe using a condom or other kinds of things that people would want to do, for example, staying safe on the internet, techniques that they can use. Pacing control is a really interesting one because having a video allows a teacher or an educator to slow the content down, so you can actually make the voiceover slower, which hopefully will allow for better comprehension and retention in some cases. I will talk later about some of the cultural and contextual differences in the diversity that our partners add to AMAZE when they dub and adapt the videos. And also just a few more things around collaborative learning. Allows for group discussions and collaborative projects. The flipped classroom model allows educators to give the students the videos to watch outside of the classroom and then come back in to have those conversations. Accessibility is something I'm going to touch on in a little bit, but again, we can add lots of things to make videos more accessible, including sign language or subtitles. And then finally, there is this all exciting idea of gamification. And AMAZE has recently launched a partnership with Kahoot. We have our own channel on the platform where our videos are housed, and then young people can watch the videos and then take some quizzes. And yeah, so I'll hand it back over. Thank you so much.
Thank you, Darcy, and for your great introduction. And just a question that, given the global reach of AMAZE videos and other products, could you share a unique adaptation or customization made for a specific cultural context and for learners with special needs, disabilities, and so on?
Great, thanks. So before I get to some specific examples, I'll just briefly touch on how people can partner with AMAZE. And there's just 5 options. So the first is that people can integrate existing videos. So you can start using any AMAZE videos today on any platform without any restrictions. So this is an example of the Ministry of Education in South Africa using the videos on their BeWise platform. The second option is to add subtitles. So those can be burned on, or they can be an option that is chosen by the user on YouTube. Again, a great way to ensure that videos are being provided in local languages, and also a really kind of fast option for a lot of partners. The third option would be to dub, and that is where a group would work with an animation studio and actors to do the voiceovers. These are some screenshots from a group in Lebanon who worked with some really well-known actors, so that's really exciting. The fourth option is around adaptation. So we have, in this screenshot, I sort of like to show it because you can see the original video, and then 2 examples of how partners have made adaptations to the actual animation. So there's changes in the skin tone and hair. There's the food has been swapped out. So you can see that if you were a young person in Fiji, you would certainly be seeing visuals that are more contextually and culturally relevant to you. And then the fifth option is around creating new videos. And this is a screenshot from a group that we just worked with in the Netherlands around the unpaid labor of women in the home. So to give you some specific examples of how our partners have been sort of working to adapt these videos and to especially make them more accessible for maybe students or young people with learning disabilities or disabilities in general. These are 2 screenshots of added sign language. So one is from Love Matters Arabic in Egypt, and the other is from Association 21 in Georgia. And yeah, again, both excellent examples of adding sign language to videos just to make them that much more relevant. We also have a fantastic partnership with a group in France called the Creative Handicap. They have they house the AMAZE videos on a special website that is specifically designed for people with disabilities, as it has a sort of ease of reading. And they've worked really hard to work on the representation and adaptations for certain disabilities. And then finally, I'll just finish with this example. In this particular video, the original video, there was a mobile phone, and it shows a telephone number of an SRHR clinic or a service provider. And in this case, our partner in India has then modified that visual, that part of the video, to show the local telephone number that young people need to use if they want to access services. So just providing some examples of how people can adapt those to make them relevant for their communities.
Yeah, okay, great. And another question for you, Darcy, is your videos are viewed all over the world in 45 languages. Who do you collaborate with to reach out to new countries and audiences? And can you share also some insights in how this collaboration process between AMAZE and UNESCO is being shaped?
Great, happy to, thanks. So one of the routes that we do use for dissemination is social media. We have over 80 million views on YouTube. As I mentioned previously, 250 original videos. And as a result of all of our international work, we now have videos in actually 60 languages. So we recently updated that, even more exciting. Yeah. And so, yeah, so certainly we are harnessing the power of social media, but we also work with a wide variety of partners. So that can include everything from UN agencies to large NGOs, all the way to youth-led organizations. We have medical professionals who are showing the videos. We work with app developers to embed the videos into apps, schools, influencers. So lots of different partners across the world who are working to help us integrate and embed AMAZE videos. On social media, we have some partners who are doing some really excellent work using some of the platforms that we're all really familiar with, like Facebook or TikTok. And then we also have groups who have done some targeted Instagram campaigns, who are sharing the videos on WhatsApp, and also some people who are putting them on kind of learning passports, so specifically UNICEF's online learning passport, which is a really fantastic way for us to increase our viewership. So lots of exciting things happening on social media, and we're always happy to talk to partners about how we can support them to use social media. Let me just go to the next slide. And then in addition, we have partners who are disseminating the videos in more traditional ways. So they're being shown in classroom settings with our partner development consortium in India. MSI has embedded the videos into teacher training that they're doing in China. We have two partners, one in Lebanon and one in Georgia, who are both showing the videos in humanitarian settings in refugee camps. In Kenya, the football matches, they're showing the videos on screens. Love Matters Kenya is doing that. And in Ukraine, we have a partner called Stop Sexting who are showing videos in metro stations and bus stops. We are very excited that in Mexico and Uganda and many other countries, they are also being shown on public access television. And we also finally have some clinicians and some groups who are showing them in clinical settings. So yeah, so we have some great projects that are being fostered with our relationships between us and UN partners, and that would include TeenGen, who have recently relaunched their fantastic platform, as well as UNICEF's Aki period tracker app. And then I'm very happy to talk a little bit about the work that we've done with Janelle and her team around this collaboration. So we worked closely with them to adapt some 9 targeted videos. And then as a result of those adaptations, we now have lesson plans, scripted lesson plans, and discussion guides that are available for anyone in the region to use. And so, yeah, so those 9 adapted videos, as I mentioned, we did these in consultation with UNESCO Bangkok office and UNFPA. And it was a real collaborative approach in talking to young people and to service providers about what types of videos they wanted to see. And so we were able to identify these videos that you can see on screen. And then as a result, some lesson plans, scripted lesson plans were created for educators. And then the discussion guides themselves were actually co-created with young people in the region. And so they have some really exciting elements in those discussion guides. For example, links to Kahoot. So if a peer educator was to deliver a session and to facilitate a conversation, they can then go on to Kahoot and do some actual really exciting quizzes.
Yeah.
So thank you very much.